I'm delighted to be passing this off to a dear friend and a wonderful physician, and I'm on the wrong camera, to talk about our next topic, cannabis. And again, this is something new on the agenda. Cannabis is becoming more and more accessible in many states. There are a lot of questions and unknowns about the impact on Duchenne. There's a lot of definitions, different types, different forms, CBD, THC, all these acronyms. We're going to explore some of this in this conversation with Dr. Sue Apkon. Importantly, we've been working with her about, putting out a survey to understand the use of cannabis in our community. Because anecdotally, we are hearing from families who may be using CBD oil by ordering it online. We don't have good data on the actual impact of the use of cannabis in Duchenne. So it's something, there's a need here to explore it. There's a need for a conversation at the end of the day. It's not something we should be really ignoring. So with that, Dr. Apkon and PPMD have been working together. I really put a lot of the credit to Dr. Apkon for putting together this survey and working with us to get it out to understand how it's being used in our community and the impact. So with that, I'm going to hand it over to my friend, Dr. Sue Apkon, to take it away.
Thank you, Ryan. It's my pleasure to be back and talking about a topic that I know is increasingly one that I'm asked to discuss in the clinic setting. For those of you who were just on this previous presentation, Dr. Parsons talked about the Friday evening drinking club. I guess I'm talking about the Saturday afternoon cannabis club with all of you. With legalization of both medicinal and recreational cannabis in many states, parents and young men are asking more about it. Next slide. I'll start by saying I have no financial stake in the cannabis industry, and also want to make sure that you realize that we still have a lot to learn about cannabis in the setting of boys and men with Duchenne and Becker, so that this presentation is not really an endorsement of the use of cannabis, but more importantly, providing people with information about it. Next slide. I'm going to spend the next 15 minutes or so helping people understand the different definitions associated with cannabis, review what we do know about it or what we don't know, and finally discuss the practical implications as someone considers whether to use it or not. Next slide. So this is a map of our country with the colors depicting the status of cannabis laws as of January of 2020. As you can see in green, there are 11 states that have legalized recreational marijuana. There are 33 states depicted in blue and also those in green that have laws making it legal to use cannabis for medicinal use. It's also legal in Washington, D.C. to purchase both recreational and for medicinal purposes. The landscape is continuously changing, which will be an important point to remember as you consider use in the state in which you live. Next slide. This is what we know about the use of cannabis in boys and men with Duchenne. There's currently really nothing written on the topic, so that what we have are anecdotes, meaning what my patients tell me. Men, interestingly, with Duchenne that I see in our adult clinic, share with me that they're using, why they use it, and how it may be helping them or side effects that they might be experiencing. Anecdotes, however, aren't really how we practice medicine. So it puts me in sometimes an uncomfortable position when parents ask for guidance on its use. I will, however, later in this presentation, try to provide you some specific guidelines to use. Next slide. There are a lot of different names, as Ryan alluded to describe cannabis. Some are more official and others a little bit more slang. Cannabis, however, is really a general term for the products of the cannabis sativa or indica plants, with marijuana being the dried leaves and flowers from those plants. Hemp is a specific strain from the cannabis sativa plant, and mostly we hear about it for its use in oils and fibrous materials from its stalk. Any cannabis sativa plant that contains more than 0.3% of THC is considered to be marijuana, and anything less than 0.3% THC is considered hemp. Generally, you can go into a regular store, convenience store in some places, and buy a cannabis product that is less than 0.3% THC, such as that you might find in lotions or oils. Next slide. It's the cannabinoids that really provide the effect that people talk about when using cannabis. These are the molecules which interact with the cannabinoid receptors in our body that provide us with the potential benefits or side effects. There are over 100 cannabinoids in the cannabis plant, with THC and CBD the most common. THC is the cannabinoid, the psychoactive properties, the high that you experience if you're smoking marijuana. And CBD is a cannabinoid that's considered non-psychoactive. It's important to know that cannabis products have variable ratios of THC and CBD, which is why you might have different benefits or potential benefits and also different side effects. People purchase cannabis with specific ratios, the accuracy of which is something we'll talk about in a few minutes. Next slide. Finally, we have the endocannabinoid system, which is the intrinsic system in all of us. It includes the endogenous cannabinoids, which we produce, the cannabinoid receptors, and the enzymes needed to synthesize and break down the cannabinoids. The system's involved with many of our bodily functions, including brain function, sleep regulation, sensory processing such as smell, emotional regulation, energy homeostasis, and even inflammation. The endocannabinoid receptors are primarily the CB1 and CB2 receptors. The CB1 receptors are seen in large part in the CNS, or the central nervous system, but also present in the muscle and the cardiovascular system. And the CB2 receptors are in the periphery and involved with pain and inflammation. Now that I've provided a little background and definitions, I'll transition to talking a little bit more about the clinical use of cannabis. I want to start by saying there are some FDA-approved cannabis products, including Epidiolex, which is used for specific childhood epilepsies, dronabinol, which is used for cancer-related nausea and vomiting, and nabilone, also for cancer-related nausea and vomiting. There are no FDA-approved cannabis drugs for Duchenne or Becker muscular dystrophy, and that's an important point to make. Next slide. As I talk about THC and CBD and the endocannabinoid receptors, it may not be surprising that there are side effects that people experience when using cannabis. This slide highlights some of the most common to least common side effects from the left side to the right side of your screen. There are two I want to point you to. They're both in the rare category, but important to know about. One is tachycardia, or a fast heart rate, something that's already present in many boys and men with Duchenne. I encourage men who use cannabis to discuss this with their cardiologists. The other rare side effect is a cannabis-associated hyperemesis syndrome, which means frequent vomiting. It's generally associated with frequent use of cannabis and can send someone down a long diagnostic workup if it's not recognized. Next slide. Now, I did say that there was nothing really written on cannabis and Duchenne or Becker muscular dystrophy, and that wasn't entirely true. There is an interesting paper that I want to share by a research team out of Italy. This team looked at the effects of cannabinoids on muscle quality and strength in the MDX mouse, as well as use in human and mouse cells in vitro. The researchers explored the impact of CBD on muscle cells of the MDX mouse, humans with and without DMD, and the immune response. Next slide. The results are certainly intriguing, but to be clear, I'm not recommending you all go out and purchase cannabis for your sons based on what they found. The results, however, did show that the mice treated with CBD or CBDV, another cannabinoid, for 2 weeks did show increased motor activity on the rotorod test, improved strength on the forelimb grip test, and even when mice were treated at older ages, there were improvements in motor activity and strength. Human and mouse cells that were treated in vitro demonstrated that CBD and CBDV promoted the differentiation of myoblast cells to myotubules. The benefits seen are thought to be related to the anti-inflammatory effects and reducing the consequences of impaired autophagy. While really intriguing results, I'm excited to see more work from this group and others and the potential for a well-designed human trial. before I make a decision as to whether to prescribe on a routine basis. Next slide. So let's transition now to the practical side of cannabis use in boys and men with Duchenne. I want to share some general thoughts about what you should be thinking about if considering the use of cannabis for yourself or your son. The first thing I'd like to say is please feel comfortable talking with your doctors about this. This is a conversation we're having on a regular basis with our patients, and it's important for us as physicians to know that a patient's taking this as a supplement because of the potential side effects that they may be experiencing. One bullet point that's not on this slide is important, and it's the fact that different formulations of products such as smoking, vaping, ingesting, or topical creams or lotions may lead to different effects, either benefits or side effects. For example, smoking cannabis will give you a quick response, with oral intake such as edibles, much longer peak effect. The difference is between minutes with smoking or vaping and up to 2 hours for edibles. Use of creams and lotions, because of their hydrophobic nature, are more limited. With CBD, which means that it's hard for the CBD to permeate the skin, and so the effect that one might get is going to be less impactful. There are a few additional things that you need to know that are on this screen. One is that because cannabis is not an FDA-approved drug, the products are unregulated. When I go to the store and buy Tylenol, and I buy a bottle extra strength that says there's 500 milligrams of Tylenol in this pill, I know there's 500 milligrams of Tylenol in that pill. As opposed to cannabis, if you go into a dispensary one day and buy a product, and you go back a month or two later and buy the same product, you might actually have a different effect because of the lack of regulation. It's also important to know that laws vary by state to state, and transporting cannabis from state to state also varies. And so understanding the legal ramifications is really important. We also don't know the drug interactions. We know in at least one, clobazam, which is a benzodiazepine that's used for kids with seizures, it does have an interaction with cannabis and it can make it more potent. And so while we have limited knowledge of it, my hope is that we'll see future studies that will help us understand it better. If you're going to think about using cannabis, we want to recommend minimizing the use of the THC. That's the psychoactive form, or the high that you get when taking cannabis. This is especially important when you're thinking about giving it to your sons. There's some literature suggesting, and I'll review it in a minute, that the impact on the growing brain is real. And in the setting of boys with Duchenne or Becker that may already have learning problems, this is especially important. I'll channel our Children's Hospital Colorado pulmonologist, Warren Kupfer, and say that at all costs, you should be avoiding inhaling either by smoking or vaping cannabis due to the respiratory risk. We're hearing a lot of about vaping-related lung injury. And when you add lung injury on top of someone who already has a restricted lung disease because of Duchenne or Becker muscular dystrophy, it's really a setup for additional problems. And finally, because of the more potent response, avoiding synthetic products is also recommended. Next slide. Now, I mentioned that cannabis is unregulated, and what that really means is that there really is a lack of consistency in products. This study by Bond Miller looked at the accuracy of labeling of cannabis products that were purchased online. And you can see that 84 products were purchased, with only a third of them having an accurate reflection of the amount of CBD listed when they analyzed it. About a quarter of those products bought online had less CBD than was labeled, and 43% of them had more CBD that was listed. And for me, what was most concerning, that 21% of the products, even when it wasn't listed on the label, there was THC that was present. Next slide. Finally, for those of you thinking about use in children, there is a study published in Pediatrics in 2017 that taught us that kids that began using under the age of 16 had decreased verbal skills, IQ, attention, memory, and executive functioning. and were at greater risk for school performance issues and even dropping out of school. Again, in the setting of a group of kids that may already have learning difficulties, adding cannabis on top of that is of great concern. Next slide. So after reviewing the definitions, the backgrounds, and some of the limited information we have on it, from research standpoint, I'd like to provide a few takeaways. We still have a lot to learn about cannabis and even more about its use in muscular dystrophy, Duchenne or Becker. The ratio of THC to CBD drives the possible benefits and side effects that one would receive if using. Minimizing the amount of THC will reduce the high you'll experience and is recommended if you're using for potential medicinal reasons, especially in children. There is intriguing early work in the MDX mouse, but I believe it's too soon to know what it really means. And finally, please use caution if you're considering cannabis use in your sons or if you're an adult yourself. We still have a lot to learn. As Ryan mentioned, one step that our team at Children's Colorado is taking is to learn more about cannabis use in our patients. We've spent the last many months working with a survey methodologist to put together a survey for all of you in the broader Duchenne Becker community for you to teach us more about use patterns, benefits, and side effects that you may be experiencing. We'll then be committed to disseminating this information more widely. So stay tuned to your PPMD emails. Once this incredible staff comes down from their high, not the cannabis high, sorry, but the high from hosting such a great conference, they will be helping me to push the survey out. So I'd like to thank you in advance for taking your time to complete it. And I am now happy to answer any questions. Thanks.
Thank you so much, Sue. This should spark a lot of conversation within the community. So we really, really do appreciate it. We will be sending out those surveys. We're actually going to take a break now